Hi, Dr. Rodriguez here. It's been a while since I connect with you all, and I just wanted to touch base with you, especially since we're talking about breast health awareness, not breast cancer awareness. It'd be better if we focus on how to prevent versus focusing on the disease itself. I want to talk to you about new guidelines for mammography. I know that a lot of doctors recommend mammograms, but they are especially high in radiation. And if you have a history or a tendency to fibrocystic breasts, the mammogram is very painful, and many times women get misdiagnosed because of the fibrocysticity in their breasts. I'm going to go over what you can do if you do have that condition to better help yourself. But what is the alternative to the mammogram? There are alternatives, and they're natural. It's called thermography. So basically, it was invented by the government, by the, I'm not sure if it was the Army or the Air Force or one of those military forces. And basically, it detects hot spots. Now, the thermography does not detect hot spots deep within the tissue, but it is a good superficial evaluation. And the only unfortunate thing is that most insurance companies do not pay for thermography, so it's something that you would have to pay out of pocket. But it's very well worth it because the mammography has a lot of radiation and it's very painful, and many women get misdiagnosed. Another great thing to get used to doing is doing self breast exams. And if your gynecologist has not taught you how to do that, there are a lot of videos online that you could look at to help you do that and be more aware of your body and the changes that can happen. But if you do thermography and there is a family history of issues in your family, or you did the self exam and you found something that is questionable, then you could follow that up with a 3D ultrasound, kind of like the ones that they do for the babies. And it would help look further deep into the tissue, and you have the two things together combined that are going to be very, very efficient at finding any kind of problem within the female breast. Another misconception too is that men don't get breast cancer, but a lot of them do. And so it's also good for the men to, take care of themselves and be aware that that could be a problem. So, what can we do if you do have fibrocystic breasts? Now, the breast tissue needs iodine, and a lot of us are deficient in iodine because they've taken it out of our salt and they've taken it out of the wheat products. Basically, they've taken it out of a lot of our nutritional foods. It would be good to find out if you do need iodine. In the office, we do an iodine patch test, and we color you with iodine on your arm, like a 2 by 2 inch spot. And the faster your body absorbs that patch of iodine, the more deficient you are. So it's a good way to evaluate it, and it's very non-invasive. Another important thing for the breast is vitamin D and vitamin E. So we got to make sure that it's very easy now to check our vitamin D levels through the blood test. And the best way to get vitamin D naturally would be to get some sunshine. Usually the arms or the legs for 10 to 15 minutes a day is sufficient. Or you could supplement. Now, the doctors have gotten into the custom of giving the patients a really high dose of vitamin D. I really don't think that's good for your body because it's not natural for your body to absorb or to take in that much vitamin D at one shot. So if you go for a more natural source of vitamin D and take a lower dose every day, it's going to be a lot more beneficial than if you do like 50,000 IUs once a week. Another good thing for the breast is good oils. So you have to stay away from canola oil, from vegetable oil, and you could stick to the good seed oils. Black currant seed oil I use a lot in the office. Evening primrose oil, especially for the women. You could use sesame seed oil. And for your cooking, you want to use coconut oil or you want to use olive oil. And you want to make sure that you're using good, clean, pure olive oil, because now companies want to make a lot of money and they mix the oils and you're not getting pure olive oil. So that's not a good. You could go to ewg.org. they're very good at telling you what's in products, what to stay away from, and they give you good alternatives as to what you can do. So I'll be back with you soon, probably next week, because I want to go a little bit more into breast health awareness and what are the things we can do. Have a blessed weekend, and I'll talk to you soon.